as our time to be together as a community and share information about the virus and how Rhode Island is doing. The answer is we're doing very well, and I'm very proud of you. It's because of your actions and the way we've come together as a community that Rhode Island is faring much, much better than other states around the country who are starting to see surges, hospitalizations going up. And so I just want to say thank you, everybody, for following the rules and doing your best, even though it's been incredibly difficult. We are going to continue these Monday, Wednesday, and Friday at 1 o'clock. So we'll be back on Friday at 1, and then again Monday at 1 o'clock. I want to thank the members of the press who are here. I've thanked them a few times through this. Most of them haven't gotten a day off since this started, and they've played a more important role than ever, I think, in this virus, keeping people informed, which means keeping people alive. And so I want to thank you guys for all that you've done. We will begin, as we always do, with a quick picture of the data, and I'd ask you to please put that up on the screen. As you can see, it's another good picture, another steady day, 49 additional cases to report, and very sadly another 11 deaths. It's every day we get up here and report deaths, and that means every day every one of us just has to pause and remember how deadly this virus is, and just say a prayer or send a thought to the family of someone who's lost a loved one, because we continue to lose Rhode Islanders every day. Having said that, in general, the picture looks very good. You can see it yourself. Hospitalizations continue to decline. Our statewide test positive rate is just about or under 2%. That's fantastic. It wasn't that long ago I was up here saying it was 20%, 20% of the people we tested were positive. Today, about 1.5%, 2% of the people we're testing are positive. That's fantastic. And we're testing more people than ever. The national average of what percent of a state's population that's been tested is just about 8%. This week, on Friday, we believe we're going to hit a huge milestone in Rhode Island. We'll be the only state in the country that will have tested 20% of our population. We're within a whisper of it now, and we think by the end of this week, Rhode Island will be the only state in America that can say we've tested 20% of our population, as compared to the national average of 7 or 8%. So why am I sharing this with you? Because if you're sitting at home and a lot of you are still nervous, and I know many people are still afraid, and I understand that, you should know that we are testing more people per capita than anywhere in America, higher than many countries, and our test positive rate is among the lowest in America. So that doesn't mean the virus is gone. It just means we've gotten used to living with it, and our results are very good. So I hope that you are starting to feel confident and more confident. Confident to go out for dinner, confident to send your kids to camp, confident to go back to church or synagogue or mosque, confident to resume your daily living routine, which is so important. We have been in phase 2 for about 2 weeks, and so I'm frequently being asked, what will phase 3 look like? I plan to dedicate the Friday press conference this week to looking at what phase 3 will look like. So if you're interested to know what the new regulations will be in phase 3, tune in Friday at 1 o'clock, and we're going to begin sharing that information. I have taken the approach where I want to tell you, I want to start previewing for you what phase 3 will look like, even though we're still weeks away from phase 3, so that you can get prepared. So if you're a small business or your family or run a summer sports league, tune in Friday, and we're going to start to give you some news about what phase 3 will look like. Today I just wanted to take a second and address, just give a preview from my vantage point of where we are, where we've been, and where we're going. And it's meant to address a question that I get often, frequently, all the time actually now, which is, governors, this is the way it's always going to be. Is this the quote-unquote new normal? Will we be wearing our masks forever? Will my kids, forever not know if they'll be able to go into regular school? Will we never be able to bring back everybody to our workplaces? So let me offer a few thoughts on that. This is what I would say. I don't like the phrase, the new normal. I don't think this is the new normal. I actually think we should set our sights higher to say that we're going to rebuild a better, stronger, healthier, more equitable, more resilient Rhode Island. I don't want to come out of this a year from now. We hope, we think, we plan to have a vaccine and a therapy. So we're not going to be living the same way we are now. We're going to have a vaccine. It'll be a different situation, a different threat. But we aren't ever going to go back to the way it was. There's never going to be normal the way it used to be. And it's on us to make sure that the way it is in a year is better than it was a year ago, because we've learned a lot going through this. So I'm not saying that this is fun. I know there's a lot of people out there struggling and suffering. And if you're unemployed, I promise you we're going to get you back to work. And if you are housing insecure and you're struggling, we're going to do everything we can to make your lives better compared to where they are now. But I am saying that I am committed to, and asking you to commit yourselves to, taking what we've learned in this crisis, the good parts of it, and making a Rhode Island a better Rhode Island on the other side of it. So, for example, we've learned that there is a permanent and forever role for distance learning and virtual learning in our K-12 public schools. As we said last week, it's the end of the snow day. Sorry, Foster Gloucester and all the kids. You're not going to have snow days anymore. You're not going to miss learning. You're going to stay home and do your work in a distanced fashion. And we now know you can do it in a great, excellent way and learn a lot. We've learned that telehealth really works. It's a fantastic way to deliver health care over the phone or over video, where you can provide access to health care, in some ways at a lower cost, just as high quality, for people who have a hard time getting to the office, getting to the doctor's office. It's not a replacement. Let me be clear. Virtual, I am getting these kids back to school in the fall. But they're going to continue to rely on distance learning, because we've learned many kids thrived with it. The same thing with doctor's offices. I am not saying you're not going to go visit your doctor again. You will. There's no substitute for in-person visits for certain things. However, if your choices are missing an appointment or having an appointment telephonically, or you can't get the bus or a car to the doctor, I'm going to work with the legislature to make sure that telehealth is permanently reimbursed in the state of Rhode Island. A month or 2 months ago, I signed an executive order requiring insurers to pay for telehealth the same way they do for in-person visits. Let's make that permanent. We know it's working, and it's breaking down barriers to access. The same thing is true for working from home. Many people have continued to work from home through this crisis. And we've done a survey of businesses. 90% of businesses say that their employees are just as productive working from home as they are in the office. So we need to enable that, which means we need to think about childcare for folks who are going to continue to work from home. Same thing about in the state. Director Smiley's done a terrific job making it so that a lot of our employees can work from home. We're going to continue that. That could be a way to reduce cost, reduce real estate costs. We might not need as many buildings, but allow the people's work in the state to continue. The DMV might not go back to the way it was. I'm sure that will be relief to some of you. We've been operating very well. by appointment only. Lots of people have said to me, Gov, don't go back. Now, it's been in a limited fashion, so obviously we would have to make changes, but this is the kind of thing that we're going to look at. DMV by appointment only, never waiting in line again. I don't know if it's possible, but it's certainly worth striving for. So, you know, I think these are just a few examples, and I'm not going to go on and on, but I offer them to say this, to provide you with some hope. It's a lot of folks out there who are losing hope, and I understand that. Right now we're in the thick of it, we're in the teeth of it. Unemployment is at a historical high. There's anxiety about what summer will look like, anxiety about what school will look like, and that's all normal, and we're going to get through that, just as we have. But I want you to start to get a little excited about the ways in which Rhode Island could be better in the future if we apply the lessons that we've learned through this time. And I would invite all of you to start thinking that way. It's changed. This economy is forever changed. There are going to be forever changes to retail, brick and mortar retail, forever changes to hospitality. And that's scary to hear if you're in that business. But what I want you to hear is we're going to embrace that change. We're going to retrain you. We're going to build on, we're going to rebuild this economy bottom up and make it better, stronger, and more jobs than we went into it. But it isn't going to be the same. But by now, we've all learned how to live with change, and we've gotten better at being flexible. I'll also say this. You should feel very proud as a Rhode Islander. You take some pride in the Rhode Island response to COVID. You've been better than really any other state I can find. Our rate of compliance with the rules is through the roof. The way our hospitals reacted quickly and turned on a dime was best in class. Our testing is best in class. The way you've reached out to help neighbors is amazing. The way our nursing homes have complied, our veterans home, just the way people have reached out to lend a hand. Rhode Islanders have united. We have benefited from the fact that we're small and connected and everybody knows everybody. That's going to help. That's helped us to get here, and that's going to help us to rebuild. So if you're feeling down or discouraged or worrying, I want you to feel confident. We made it this far. We're doing better than any other state. It's still tough, but we are going to stay united and rebuild together. And I have every confidence that we are going to be successful. And when we finally have a vaccine, you know, that'll be great, but also I think our economy and our healthcare system and our educational system and the way we deliver state services is going to be even better than when we started this. And I'm looking forward to that. I said today that I was going to address high-density communities, and so I'd like to do that for a minute or two. So I said earlier that we're doing remarkably well with the virus, and Dr. Alexander Scott will touch on this. The statewide percent positive rate is very low, just under 2%. But if you look around the country, this is really important, if you look around the country, around the world, at the states that are getting into trouble, you know, where they're seeing hospitalizations start to climb, spikes in cases, more often than not, their statewide percent positive was good, but they had pockets of outbreaks. So in Texas, 45% of their new cases are in their prison system. In other cities and states where you're starting to see spikes in hospitalizations, it's because they have one county, one community, one set of nursing homes, whatever, one geography, where there was an outbreak happening and they didn't put a lid on it fast enough. So from this point forward, it's actually, I think, in some ways more important that we keep our eye firmly on these densely populated communities and communal living communities, and big employers like manufacturers where people work closely. It's really important that we keep our eye on that, because you could have a 2% test positive rate in the state, but an outbreak happening under your nose in a particular community. And so to that point, our team starts every day and ends every day looking at the data in certain communities where, frankly, we've been struggling to get the test positive rate where we need it to be. We know in poorer communities, immigrant communities, and densely populated communities, the virus thrives. And frankly, that's not hard to understand why. Lots of low-income folks have had to continue to go to work in offices, or excuse me, out of their home, in a grocery store, in a nursing home, etc. So they've been exposed. Then they come home to a crowded apartment, maybe a multi-generational crowded apartment. One person gets sick, before you know it, the whole family's sick. They're all living closely together. It's a reality. So we have had to really focus extensively on these communities. We are making sure that our contact tracers are multilingual. We are making sure we increase testing in these communities. We are trying hard to increase awareness in these communities, breaking down language barriers, and we're trying to take a very individualized approach. What works in Central Falls is different than Providence, is different than Pawtucket, is different than Woonsocket, and frankly, certain neighborhoods in Providence are different from one another. The truth of it is, every community is different, and so we have to, the beauty of being small, as we are in Rhode Island, and connected and knowing our communities, is we can be personalized in our approach, and I think that's a huge reason why we've been ahead of the curve compared to some other places. So let me tell you specifically today about a few things we're doing. I want to tell you about the results we're having and make a few new announcements. So with respect to testing, we've been bringing testing into the neighborhoods that are most affected. And specifically, we're working closely with community health centers to bring testing where it's most accessible to the most people. In many cases there, we have created and we continue to create, as recently as today, creating more walk-through sites and drive-through sites. So if you live in Central Falls, Providence, Pawtucket, Woonsocket, North Providence, please consider getting tested. Definitely get tested if you're sick. And if you don't have a car, I promise you, if you live in one of those communities, there is a testing site close enough for you to walk to, or call or go to the community health center, and we'll figure out a way to get you tested. Secondly, we have our health equity zones. Dr. Alexander Scott has been a leader on health equity zones for 5 years, but we are further investing. That's healthcare in the community. And then contact tracing, the people from the Department of Health and the National Guard who do the contact tracing, we've really ramped up our efforts to make sure that we have multilingual people who do the contact tracing who are representative of the communities, oftentimes from the communities that they're engaging with. And I want to give a big thank you to the Latino advisory group that I created months ago. They put this firmly on our radar, which is if you're going to be doing testing in contact tracing in Central Falls, the person on the phone should, maybe come from that community, speak the language of the person on the other end of the line, and have an awareness of what's going on. So I cannot say this enough. If you are hearing me, if you live in Central Falls, if you live in the west side or south side of Providence, if you live in Pawtucket, if you live in Woonsocket, if you feel sick, if you think you've been near someone who has had COVID, please, please get tested. Don't worry if you can't pay for it. Don't worry about your immigration status. Don't worry if you don't have a car. Call the community health center. Call the Department of Health. Use the Crush COVID RI app. but we want you to get tested because we need to keep we need to keep you healthy, and we need to, make sure that these communities are safe and we don't have any kind of an outbreak. Now, to that point, I want to give you some data. So our percent positive rate in Central Falls today is in the low teens. It's about 13%. 2 weeks ago, it was 22%. 13% is too high. We have to get Central Falls test positive below 10%. So we have to do more testing. But if you're listening to me and you're nervous, in a couple weeks, we've gone from 22% to 13% in a very densely populated community. That's good progress. So thank you. Let's keep going. The percent positive rate in Providence has been below 10% for a few days now. It was about 18, 19% at the end of May. That's a big relief to me and should be a big relief to you. It's our capital city. We have to keep all neighborhoods in Providence below 10%. It's a large population, and we're there. We're there, and we have to stay there, and we have to drive it lower. Pawtucket, doing a great job in Pawtucket, has been steadily at or below 10% for the past few weeks, so that's reassuring. Breathe a sigh of relief. And in Woonsocket, we've seen a slow decline, steady decline over the past few weeks, and we're now consistently testing at about 6%, whereas we were at 15% in Woonsocket a few weeks ago. And big thank you to the community health centers in Woonsocket. So I want to say this. These numbers are a point in time. They will fluctuate, but they are all good news. This is all good news. And it's all directly related to the fact that the people in those communities have come out to get tested, and that we are totally committed to bringing care to the community through the things I said: testing, health equity zones, and contact tracing. And I'm going to continue to talk about this. This is what we need to keep our eye on: nursing homes, congregate care settings, densely populated cities. When the students come back, dormitories. These are the areas that we have to keep our eye on. In addition to the fact that we've seen a decrease in new cases, part of the reason we're seeing a decline in the percent positive statewide is because we've started our new asymptomatic testing program, testing people who don't feel sick. It's an early warning system, as we've talked about, and we want as many people to have access to this as possible. We want to be testing large volumes of people who are not sick. People are, I think, confused by this. They're saying, why would I get tested if I don't feel sick? We need you to get tested even if you don't feel sick. It's free, because we need to know roughly how many people in our population have the virus or have been exposed to the virus. So to that end, today I'm announcing that we're adding new asymptomatic testing sites in communities. Eligible Rhode Islanders without symptoms will be able to get tested at 4 Stop and Shop locations across the state. These locations are in Cranston, Pawtucket, and the two Stop and Shops in Providence, one on Manton Avenue and one on West River Street. So Stop and Shops in Cranston, Pawtucket, Manton Avenue in Providence, West River Street in Providence. Testing will take place every Thursday, Friday, Saturday, and Monday, and we have capacity to run 30 tests per day at each Stop and Shop location. This is in addition to the 900 we want to be running at CCRI and Rhode Island College. So I'm going to remind you one more time. If you are a child care worker, a barber, a hairdresser, cosmetologist, work at a gym, exercise trainer, physical therapist, any kind of personal service worker, public transit driver, a bus driver, a restaurant worker, if you've attended a large protest or big group gathering or any kind of demonstration where there's a lot of people that you were near and you stayed for a while, we would ask you, please, even if you feel great, even if you don't feel sick, we would ask you, please, to go get tested. You can make an appointment at the Stop and Shop sites or at RIC or CCRI by going to portal.ri.gov, or you could call the Department of Health 222-8022. It's really important that we do this. Think of it just as like doing your part. Throughout this whole crisis, people have constantly said to me, how can I help? What can I do? My answer to that question now is go get tested. Portal.ri.gov. If you work in any kind of business where you're in close contact, or if you've been to a protest or a large group gathering, please go get yourself tested. It's going to help. It might not help you specifically. You're probably going to be negative if you feel fine, but it'll help the rest of Rhode Island, and it'll help us keep everyone safe. It'll help us move to phase 3 quickly. It'll help us move beyond that. It'll help us get the kids back to school. It's exactly what we need to do. So I'm asking you please to consider doing it.